Okay, good afternoon. You are all here because you teach 10th graders, and I am your school counselor, Dresden, Hester, and I'm going to talk to you about the warning signs of depression in your students and how you can go about referring them to the counseling center. Depression is the most common psychological problem of adolescents, with 15 to 20% of teenagers who have had one or more major depressive episodes. The stereotypical view of teenagers as dramatic and overly emotional can lead adults to minimize the seriousness of the condition by assuming it's just a phase. But without intervention, depression can lead to very serious situations. To give you a little background on depression, the biology makeup and environmental factors can lead to depression, but it is usually a different kind of combination for each person. Depression can also be activated by an experience, like a parental divorce or failing at something important. And as we all know, divorce and academic or athletic failure is a common experience for teenagers. The most serious of consequences are, of course, suicide and depressed individuals who end up harming others. Mental health in adolescents is a hot topic right now because of the epidemic of school shootings and suicide that can be the consequence of bullying. Suicide is the third leading cause of death among American youths. So it is our job as educators to pick up on the signals that a depressed teenager sends. So what can we do? We can closely observe our students' behavior, and we can watch out for the behaviors that reflect these depressive characteristics. And they are broken down into 4 different categories. So the first would be affective, which is a depressed affect, unusually sad, lonely, and apathetic. Another category would be cognitive. So if you notice negative comments that students are making about themselves that indicate low self-esteem or excessive guilt and pessimism. The third category is motivational. So if a student's avoiding doing demanding tasks or partaking in social experiences. And the last is physiological, which are physical complaints about headache, fatigue, or illness, problems sleeping or eating. So when these characteristics are displayed frequently and for more than 2 weeks, students should absolutely be referred to the counseling center. I have made these school counseling referral forms, and the purpose of these is for the teacher to fill them out and put them in the school counselor box. And the school counselors will review them and then follow up with teachers on how the students are doing. So I'm going to pass these out to you and go over them quickly, and you guys can ask questions if you have any at the end. So here at the top, you'll be writing the student's name. You know, they're in 10th grade, and your name here is the teacher, the date that you're writing the referral, and the reason in your own words for the referral. So these are going to be used for sudden changes in personal behavior or mental health. So if there's a student who has like chronic absences, then you can assume that we're taking care of them, you know, with that problem. This is more of something that seems out of character for your student and sort of out of the blue and something that you're observing as abnormal. So you'll want to check all that apply here in this list, which is what we talked about a little bit earlier. So sudden changes in mood or behavior or habits, isolation during classroom activities, mentioning of hurting oneself or others, lack of focus during classwork, sudden absences and tardiness, complaints of headaches or other pain, associating with troublemaking peers, portraying sadness or hopelessness, and restlessness and agitation. So then we have some lines here for you to further explain your above concerns, or obviously add something if it's not already listed here. And then in the next portion, we'll want you to write down any interventions that have been made by the student already. So you know, if you think that maybe putting the student who is suddenly having a hard time participating in the front, you know, that would be an intervention that you've already tried. So you'll want to list this here so we'll kind of know what the patterns are. How long you've had this concern, so today, a few days, 1 week, or 2 weeks or more. I had said earlier that depression's typically described as these symptoms for 2 weeks or more, but of course, it's always great to to intervene early. So if you've only noticed for a few days that one of your students who's normally the first to read in the reading circle is now, for the last 2 or 3 days, seeming kind of, like not like him or herself, then it's okay to fill one of these out. Just make sure you mark it here, and then we'll make sure to follow up with the student and keep tabs on sort of how the student's doing. The next portion will be about whether it's been discussed with the student's parent or guardian. We always want teachers to go to parents first before getting the counselors involved. So make sure that you indicate that here and explain the outcome of that discussion. The last portion of the referral form is about the severity of the referral. So like the circumstance that I just brought up a couple minutes ago about your student that you've noticed for the last couple days isn't participating, that would be kind of a less serious scenario. And then of course the very serious would be talks about suicide and things of that nature. So once we know the severity of it, then we can sort of prioritize who needs to be seen first. And then, as always, we'll be following up with you guys on each of your students' referrals. So do any of you have any questions about how to manage this in your classroom? And yes.
So it's okay to go directly to a parent or guardian and talk to them about the student, that you don't have to notify the school office or anything like that prior to, so you can just go directly.
Right, so this is something that you would typically discuss in a parent-teacher conference.
Okay.
Anyone else? Good. All right, thank you, and make sure to let me know if you guys have any questions about the referral form or anything like that. Thank you.
So, as you just witnessed, I did a role play video with some teachers as the school counselor, talking to them about what they should be looking for as far as warning signs in their students. I did a lot of research in our first course about how the school counseling comprehensive programs need to include school counseling classroom instruction and also training to teachers. So I thought it would be interesting to not just speak to the class as a school counselor, but try to figure out a way to speak to the teachers about how they can handle some of these things and intervene before the student is sent to the school counseling center. I took a template out of the book, The Use of Data in School Counseling by Trish Hatch, and it was more of, it wasn't really narrowly focused on depression symptoms, but I used it as a template and created this on my own, thinking that it would be a great tool for teachers to have, to use as referral forms to stay organized and know where we are with our students and follow their journeys and keep it all documented. So I think that this is a great way to get teachers on board and work together for school counselors to be part of the leadership team, and of course to take care of our most at-risk students. It was a little bit hard and complicated and confusing to talk about this with my role play audience, because afterward, two of my colleagues at my work now, two of my fake teachers, said, well, what about my daughter? She's got half of these symptoms, and it's because she's a teenager. But I'm not real concerned. But isn't this pretty typical of a teenager? And I told them that is what makes this complicated and complex, because we are used to seeing teenagers behave this way already, and so it's very important to sort of make the distinction between the two. But hopefully, as people narrow in on their number one focus being the well-being of the children and their mental health, we can get squared away, and do our due diligence to our students. Thank you.